A lot of patients have questions about orthodontic therapy or the movement of teeth for young people and adults alike. So let's talk a little bit about, first for children, how we approach considerations for braces, and then we'll move to how we think about moving teeth for adults. Obviously, the first and most significant reasons to consider braces are if a patient, a child, is exhibiting what we call a functional deficit. What that means is that the teeth are misaligned in a way that actually inhibits proper chewing or speech. And those types of problems are pretty significant. If your child has a functional deficit, you'll likely know. We would categorize things like significant overbite, open bite, where they can't close their teeth all the way together. And also, some kids are born with skulls and jaw bones that are shaped in a way that kind of misaligns the teeth and makes chewing and functioning more difficult. Children that have significant functional deficits or misalignment of teeth can often, if untreated, have problems later on in life. Kids that have these large functional deficits, sometimes they get them from habits like thumb sucking, can actually create a protrusion in the maxilla or the upper jaw that can affect the way the kids' teeth come together. Sometimes we're born with discrepancies, but most of the time these problems will not self-correct and need intervention of an orthodontist. Kids that have small deficits that affect function a little bit but need orthodontic tooth movement to help improve the look and condition of their smile kind of fall into the second category. And I would say most kids are in this place where the misalignment of the teeth is creating a little bit of a problem in terms of function, but most of the discrepancy or the challenge is in creating a smile that looks and functions good as they get a little bit older. The tendency now in dentistry is to consider something called two-stage orthodontic therapy. Many years ago, most people my age, we got braces kind of at the end of middle school and wore them through high school, and then you got them off. Putting braces on earlier is actually easier because it allows us to guide the grown-up teeth in proper position, and we have to do less movement in total. And it involves putting on braces or using things like Invisalign to correct teeth when they still have some baby teeth. And this creates a happy amount of space for grown-up teeth to come into position in healthy places. And then oftentimes the braces come off and then are actually put back on again later just to tidy things up and really orient the smile in a healthy way. It's usually no more expensive than regular orthodontic therapy. It can often mean that the child is in braces actually less total time, even though they're getting them on and off twice. And it can be a really, really effective way to avoid significant problems that require things like jaw surgery or pulling or losing grown-up teeth in order to make corrections. The national average is about 25% of kids have to have at least 2 teeth extracted when they're undergoing braces to create enough room for a nice, happy, and healthy smile. If we intervene earlier and put braces on or use Invisalign at younger stages, we can avoid some of those problems by creating space, guiding the growth of the jaw bones and the teeth so that we don't need those more dramatic solutions like surgery later on. When we talk about adults considering things like orthodontia or moving teeth, there can be a number of reasons why we do that. Most of the time adults don't consider something like braces and they might not be dissatisfied with the look or appearance of their teeth, but oftentimes creating an ideal relationship between the upper teeth and the lower teeth can set a patient up for success to do other things. Most patients have challenges with the way that their teeth come together. In dentistry, we call that occlusion, which basically means the bite or the way that the teeth connect. If these types of things aren't optimized, teeth tend to break down and wear faster. Teeth that are misoriented or angled improperly are often more susceptible to periodontal pocketing or bacteria getting under the gum tissue. We also see cavities form in areas where teeth overlap. It might be hard to brush or floss and keep those areas clean. And then when we undergo things like crowns or bridges or dental implants, A healthy occlusal relationship or biting relationship kind of sets those types of things up for much more predictable long-term success. We can do a really great job with a dental veneer or a dental crown or a dental filling, but if it's not biting properly, it's very hard to predict how that will last and function. Another reason why we would consider tooth movement or orthodontia as an adult would be to widen the arch forms. A lot of patients exhibit a constricted arch form. What that means is that the teeth are kind of pinched in and a little more narrow in this area than they ought to be. When we fall asleep, the proper position of our tongue is actually suctioned kind of to the roof of your mouth. And this suctioning actually pulls and draws the tongue up and forward, and that pulls and moves some of the muscles of the throat and allows a nice fluid space for air to breathe normally during sleep. If we have a constricted arch form and the palate or roof of the mouth is not wide enough to accommodate the tongue, sometimes that tongue can fall back and obstruct the airway. And this can create things like sleep disordered breathing or even contribute to problems like sleep apnea. There's a lot of reasons why we might consider braces or tooth movement as an adult, and they're not all about vanity or creating a healthy smile. That's a benefit and sometimes can be a nice cherry on top, but setting the foundation for healthy teeth relationships in the mouth is super important if we're going to be spending money and investing in things like crowns or implants or veneers or even fillings. We need to have great relationships between the teeth. One of the ways that we move teeth now is through clear aligner therapy. Many patients know this as Invisalign. I like to think about the distinction between braces and clear aligners a lot like the difference between a front-wheel drive and a rear-wheel drive car. Conventional braces, brackets and wires pull teeth, and Invisalign pushes teeth. And when we think about the difference between a front-wheel drive and a rear-wheel drive car, we understand that there are things that a front-wheel drive car that pulls the car is really good at, like driving through rain and snow. And there are also things that a rear-wheel drive car that pushes the car is really good at, like driving fast or drag racing, etc. Invisalign therapy or clear aligner therapy that pushes the teeth is really, really good at some things. It can also be really, really bad at others. Some patients require their teeth to be extruded or pulled out of the mouth higher. Invisalign tends to not do this. Other patients need teeth to be pushed inward. Invisalign or clear aligner therapy does this exceedingly well. So depending on the nature of your teeth, where they are and where they need to go, clear aligner therapy may be a perfect choice for you or a really poor choice. If you notice, I have some brackets and wires on right now. It took a little convincing from a friend of mine, my dentist, to get me in them, but I had what's called an open bite in the posterior, which means my back teeth actually weren't touching when I bit together. And this required movement of my teeth upwards or into plane with one another. And that can be a process that's difficult with clear aligners. Now, trust me, I would have preferred them, and I may end up in them at some point. But to get the results that I needed, I had to be in brackets and wires. Nowadays, there's a lot of products coming out that are competing with products like Invisalign. At Premier Dental, we really value our relationship with Invisalign. They're certainly the market leader. Their technology is more advanced than just about anybody in the marketplace. They've completed around 7 million cases of clear aligner therapy, and every single one of those cases is fully digitized and in a computer system, and that allows the computer technology to essentially comb through all 7 million cases that have ever been done and identify similarities to the way that your teeth are. And this creates a very predictable path forward in terms of getting you where you need to be, because in 7 million tries, chances are the computer system and the Invisalign therapy has seen or done this before. Having said that, there's other products available, other companies who are offering clear aligner therapy that do a great job. Invisalign is not the only one on the market, and it's not the only one achieving great results. We get a lot of questions about things like Smile Direct Club, which is the at-home clear aligner therapy. You take your own impression, and then you complete the clear aligner therapy basically at home without the supervision of a dentist. But studies show that as many as 50% of these patients actually end up in a dental office paying a dentist to help them fix what didn't go well. I always tell patients, if you're considering something like this, have an honest conversation with your provider. I have a patient or two that I've actually directed, you know what, go ahead and give it a try, because I think the type of tooth movement that you're trying to do is minimal, and it's likely that you can get a decent result at home. But most patients can benefit from the guidance of a dentist and using a product that has a track record that's a little bit more significant than those at-home products. Additionally, there's some new products available, including through our partners at Invisalign, that were designed to compete in a cost capacity with things like Smile Direct Club. So there's a new product called Invisalign Go, or iGo, that is essentially an Invisalign version of the Smile Direct Club approach that can create straight and really pretty smiles for about half the cost of normal Invisalign, which brings it competitively into the range with the at-home products. If you're considering clear aligners and you've explored the option of doing it at home, have a conversation with your dentist. There might be a product that also works great for you that allows you to participate with your dentist. One of the hardest things that I have to do is a patient that's in Smile Direct Club is having problems. Things aren't going great, or not feeling right, or not moving, and they bring the trays in and they ask for my help, and I can't help them, because legally that's not my treatment. And the second that I do something and intervene in the treatment, I become liable. So patients get into a situation where things aren't going great and they can't get help. And that's why a lot of patients end up kind of abandoning those protocols and ending up in a dental office. Because if I didn't design the product and the treatment sequence start to finish, it's usually not something that I'm willing to intervene on, because I can't stand behind some of the choices that were made. So before you embark on anything like that, make sure that you're talking to your dentist and your dental team. Ask questions, they'll be happy to answer and kind of direct you in a way that works best for you.